Hello class, my name is Alex, and for my persuasive speech, I will be talking about PASS, which is Patient Assisting Suicide. Now, there are many patients with terminal illnesses all over the world. Some have no choice in the matter of deciding what to do with their life. Now, PASS is another option for patients with terminal illnesses and unacceptable suffering. Now, have you ever had a family member diagnosed with a terminal illness and a prognosis of 6 months or less to live? There are millions of people in this world that die in hospital beds after living off a machine for several months, some even years, with uncontrollable pain with no remedy to fully control it. We as individuals should have control over our own life. We deserve the right to not only be offered PASS, but also be educated and made aware that there are other options when a terminal illness and a prognosis of 6 months or less to live has been given to us. We should not be limited to only one option. Now, a physician-assisted suicide or PASS is an option that should be available in all states. Currently, it's only available in 5 US states, which is Oregon, Vermont, Washington, California, and Montana. Now, they all have different laws and rules. In Oregon, the physician must be a doctor of medicine or a doctor or of osteopathy. In Vermont and Washington, only a doctor of medicine or a doctor of osteopathy may write this prescription. In California, an individual seeking to obtain a prescription for an indying drug shall submit 2 oral requests, a minimum of 15 days apart, and a written request to his or her attending physician. And Montana is a little bit different. In Montana, it is an option given via court decision only. Now, making it more available will end pain and suffering in many patients. Who wants to be limited to unacceptable suffering? Now, other states should revisit current laws in states that currently practice PASS and see if it fits them. Now, a patient should have the right to control the circumstances of his or her own death and to determine how much suffering is too much. There are alternatives individuals can exercise to end suffering with suffering. For example, individuals have the right to voluntarily stop eating and drinking. Individuals have the right to stop treatment or not stop treatment at all. Competent individuals have the right to refuse medical therapies. However, with PASS, you avoid all acceptable suffering. Now, if a patient's pain and suffering cannot be sufficiently relieved with state-of-the-art palliative care, then the physician should have an obligation to do everything within his or her power to relieve that suffering. Patients must meet stringent eligibility requirements for PASS. They have to, of course, be an adult. They have to be a state resident. They have to be mentally competent, and they have having a terminal diagnosis with a 6-month prognosis as confirmed by 2 licensed physicians, not just one. Now, only the patient himself or herself can make the oral request for such medication, and it has to be done in person. Imagine if everyone had access to this, how much unbearable pain by knowing the outcome could be avoided. Imagine if we all had full control over life to where we could decide when enough is enough and have a professional assist us in ending our uncontrollable pain. So in conclusion, terminally ill patients with decision-making capacity who experience unacceptable suffering should be given PASS as an option. It is unfair in states that do not recognize this law that terminally ill patients must go through suffering through months, knowing that the pain cannot be relieved and death cannot be hastened, even after knowing that due to such illness, death is inevitable. If I personally was given a 6-month prognosis after months and months of suffering, I would like to have another option other than suffering. It's only fair to me to decide what to do and how to end my life, either by continuing to suffer or by hastening my death. Thanks for listening. Have a good night.